Hi, everybody. And yes, my name is Amanda Bucknia. My pronouns are she and her, and I'm the Policy and Planning Coordinator at Away Home Canada, and have the immense privilege and pleasure of working with the Systems Planning Collective, which is a joint initiative between Away Home Canada, the Canadian Observatory on Homelessness, and Help Seeker Technologies. Lindsay, if you could actually skip ahead to the next 2 slides from here. There we go, that's perfect. So before we jump into the content for today, I'd first like to invite everybody into a bit of grounding and acknowledgement of and reflection on the Indigenous peoples whose lands and waterways we reside and benefit from here on Turtle Island. I'd also like us to reflect on our obligations to care for these lands and waterways and work in solidarity with First Nations, Métis, and Inuit resurgence and reclamation efforts. We're joining in this dialogue from all across Turtle Island. So if you know whose lands you're joining us from today, please let us know who you are and where you're from in the chat. And if you're unaware, this is your invitation to start that personal work of learning more about the peoples whose traditional territories you occupy. I'm personally joining from the area known as Takaronto, or today known as Toronto, which has been cared for by the Anishinaabe, Haudenosaunee Confederacy, and Huron-Wendat. It's now home to many First Nation, Inuit, and Métis communities, and we acknowledge that the current treaty holders are the Mississauga of the Credit First Nation. This territory is also subject to the Dish with One Spoon Wampum Belt Covenant, which is an agreement to peaceably share and care for the Great Lakes region. So before we jump into our content, I would first like to invite our esteemed colleague, collaborator, and one of our panelists for today, Shannon Murphy of Nisqually Consulting Group, to share a few words with us to start us off in a good way.
Nyawe, Amanda, and Sago, everyone. Thank you for joining. It's so great to have everyone here. So I'm Shannon Murphy from Nisqually Consulting Group. I am coming in from Niagara Falls, which is territory of the Haudenosaunee. So what we always like to acknowledge and encourage you, if you don't know, is also to think about that connection to the land and to the water, to think about what did the lands give and the water give you to reside where you are right now, and the people that were previously there. So thank you for that. We wanted to start off today, and through consultation with our elders and some of our knowledge keepers, we wanted to take the time today to bring light to Kamloops and have a moment of silence for the 215 children that were discovered in a mass grave. So we're going to begin with a moment of silence, and then I'm going to share some words after. But please, if we can take a minute just to send our prayers to those family members, to the communities, and to our First Nations community across Turtle Island, as we're all impacted by this find. So we can just take a moment now. We thank you for this moment in time. Our communities are suffering right now. We have always been aware and have been advocating for years to bring our children home. So this is not a shock to our Indigenous communities, whereas it is a shock that our voices need to continue to be heard. We need to express that we have 138 more schools that we need to check the grounds so that we can bring our children home. These children could have been spouses to you, they could be co-workers, they could be family friends, they could have been our leaders. It is heartbreaking to know that community members are still in a journey of healing to understand and to heal from this. Because as we learn about this too, these children did not die of natural causes. So this is a part of this genocide that, you know, things like nutrition and care and love and kindness could have prevented this. And we know that this is the beginning of a next part of our journey. And we accept thoughts and prayers, but we also ask for policy and change. We have been a part of many tables, many reports, and put forward many recommendations, pleading for our children to be brought home, pleading for there to be awareness around our murdered and missing Indigenous women. And we make that call again. And right now we need policy change, and this needs to happen now. And we are all a part of this because these children are a part of all of our community. And as an elder once shared with me, our blood is all red and all runs red. So we all have a responsibility to bringing our children home, to bringing awareness to this, and letting our voices be heard and hearing our truths, because this has been something that we have been advocating and pleading for from the beginning. And we continue to unite our voices to call for action, that the systematic racism and policy change happens now. And a part of the conversations that we will have today is just that, is about this system transformation and making that change. So it is wonderful to be here, be a part of this panel and be a part of this work as we continue to advocate and move forward with system change, so that our next generations can know a different world and know that they are valued and that they are someone, and that we hold space to hold up our future leaders. So Nyawa for this time.
Thanks so much, Shannon. And thank you for really helping to ground this conversation for today. And I hope that as panelists and myself as a moderator, but also as participants, will continue to reflect on the ways that we can combat colonialism and white supremacy in our work for systems transformation. Lindsay, if you could go to the next slide. We're going to start off, before we jump into our panel, before I introduce our panelists, I think it's really helpful to give a sense of where we're coming from with our conversation today. So I'm going to give you a bit of background to ground our conversation, give some context, and then I'll introduce our panelists and we'll get into what everybody's here for, which is to have some conversation and to bring your questions. And so as we're going through, as Lindsay said, feel free to drop questions in the chat. We'll give some dedicated time about, we're going to aim for 30 minutes at the end, but if, I'm going to do my best as a moderator to keep us on time. But if we don't get to all questions at the end, we'll make sure that we take note of those questions, and it could inform future presentations and panels and things that we want to do moving forward. So Lindsay, if you go to the next slide. A bit more about the Systems Planning Collective and why we do what we do. Our vision is really to create safe and just communities for all, where systems are working in solidarity to prevent and end homelessness. And our mission then is to support communities to learn from one another and mobilize knowledge on holistic, cross-systems, rights-based approaches to preventing and ending homelessness. Next slide. So we, as kind of a big part of that work, and back in the fall of last year, what we did was we started up a community of practice where we wanted to bring folks together from across Canada that were doing the work on the ground in their communities in various capacities to work across systems and do this work to transform the way that we think about and approach homelessness in our communities and across Canada. So we convened a bunch of folks that are working in different positions and capacities, whether in municipal government, local, national, or provincial and territorial coalitions, community organizations, anybody that's engaging with this work and really asking those questions about how do we do this in a cross-systems way that breaks outside of just the homeless serving sector. And so this community practice we have been convening for a bit of time now. And one of the first steps that we wanted to take was to capture some of that initial knowledge and the challenges and opportunities that were on the ground. So Lindsay, if you could go to the next slide. That's kind of what led to the report that we launched at the end of May, which is called The State of Systems Approaches to Preventing and Ending Homelessness in Canada, a preliminary report and framework for systems transformation, which I apologize, we are terrible at coming up with short and sweet names, but it is a jam-packed report full of a lot of ideas. And so what we really wanted to do with this report was, as I said, like capture those opportunities and challenges on the ground, because we know that communities are doing incredible work to try to coordinate themselves, coordinate their efforts, particularly in the homeless serving sector, but they're still bumping up against barriers and challenges. And so what are those things that we can work better to remove, and how can we call on those other systems to support us in this work better? So we had months of dialogue as the community of practice with folks that are in other organizations across Canada to start to unpack these ideas. And we received some funding from the Government of Canada's Reaching Home, Canada's Homelessness Strategy and Community Capacity Innovation funding stream to support this initial kind of scoping work. And so today's dialogue is really using that report and the systems transformation framework as the jumping off point for our conversation. If you haven't read the report, that's okay. I'm going to give a little bit of insight into what's covered in there, and hopefully it'll kind of give you the nudge you need to read it. But what we're hoping to do is have this as our first kind of national dialogue to start to unpack what's in there. And it's going to be hopefully the first of many, because there's so much in there. We only have an hour and a half with you today, and the conversation is going to go by quick. And it's only going to be the start of this kind of conversation with folks. Lindsay, if you could go to the next slide. So who is this for? In the report, we outlined that this is really, the idea around this report is to spark some ideas and interest and dialogue with folks, to have conversations, to really think about what comes next for communities in our efforts to prevent and end homelessness. And so this could be, you could be reading this from the perspective of somebody who's leading the work in your community or your province or territory. It could be that you're a funder or a policymaker or somebody in a decision-making position or position of power who wants to think about how to better support the work on the ground, and maybe even getting out of the way in some ways when we're thinking about systemic barriers. And finally, it's for advocates, academics, community organizers, anybody that may be in a position to mobilize research and action around the areas and the content that's in this report. And so, as I said, we know that communities are doing a lot of great work. They're still coming up against challenges. So where do we go from here? And what is the change that we want to see? Is kind of the question that we start to ask in this report. So if we go to the next slide. The Systems Planning Collective has, from early days when we first started creating some content around this, thinking about cross-systems approaches, we outlined 3 key shifts that we were hoping to see that really could take us to the next level with our approach to homelessness. The first is the shift from eligibility and charity-based approaches to rights-based responses. How do we really be person-centered? How do we really meet people where they're at, not setting up barriers or hoops for folks to jump through, and also thinking about it from the rights that people hold and what they're owed to as community members, to make sure that people are cared for where they're at in the community. The next is around emergency and crisis response and shifting to prevention and sustained exits. And if you've listened to anything that Away Home Canada or the Canadian Observatory on Homelessness has presented in the past, you're probably sick of hearing about prevention, but it's so important. We believe that communities really do get stuck in this crisis-focused response, having to dig their way out of crisis, and individuals, people experiencing homelessness, having to be at a crisis moment before they get support, as opposed to really focusing upstream, which is where we want to get to through policy and through our practices. And then finally, this focus on the homeless serving sector, we want to break out again to thinking about cross-system solidarity. The homeless serving sector is a small piece of a community's social safety net. And so we're really putting a lot of burden on that tiny and minimally resourced section of our community, when we know that there are other systems that have a responsibility. And so how do we really think about everybody working in solidarity to take responsibility for their role in addressing homelessness? So next slide. The other thing that was really informing this report, and something that we get into in a bit more detail in the report, are some trends and forces that are shaping the way we think about these conversations on systems transformation. So that includes a number of things, including the resurgence of movements for equity and justice over the past year around anti-racism, land back movements, including movements and voices of folks with lived and living experience and expertise that are calling for change and for equity and justice. The other piece is obviously COVID-19 has had various impacts on communities. Some it's totally disrupted long-term planning, has got them right back into crisis management mode. And for other communities, they're thinking about, okay, now that actually we've been sort of spurred on to work closer together in some ways out of COVID-19. So how do we maybe build on that and think about where we want to go in the future? The other piece is this very government and policy landscape. Everybody's working in a different context when you're looking at having municipal governments, Indigenous governance that maybe you may either have relationships with or not established. Then you have to navigate provincial and territorial and federal policy. So all these things that communities are having to navigate. And then the final piece was around data and technology, communities improving their data infrastructure, but also seeing tech wanting to get more involved in addressing social challenges and communities. So all these kind of factors we have to kind of hold as we're thinking about systems transformation. And so then the question for us became, how do we even unpack the change that we need to see, and how do we think about it with these kind of contextual factors in mind? So if you go to the next slide. we used an approach of, there's an organization called FSG who released a report called the Water Systems Change that outlines 6 conditions of systems change that kind of, we need focus on all of these areas if we're really going to see systems change. So what we did with the community of practice was used each of these 6 conditions as a bit of a container for discussion with the community of practice. Let's dig into each one of these things, have some discussion, and see what comes out of it, what kind of is, what emerges out of that conversation. And so what we realized through doing this was that as the Systems Planning Collective, we had been really focused on the planning piece, but what we needed to do was actually contextualize that better within the broader scope of where are we trying to go with planning? Are we actually oriented toward equity and justice? Are we trying to actually transform systems through this work, or are we planning just for planning's sake? And so that basically really drove us into getting into this conversation about systems transformation. So if you go to the next slide. That's where we get our systems transformation framework. And so to orient you to what's on the screen here, if we look from left to right, we have our 6 conditions of systems change down the left side there. But we also have in the middle 4 spheres of sort of change and activity. There's the systems thinking and awareness, systems planning, implementation, and evaluation, which is that section that the Systems Planning Collective was really focused on, systems change and accountability, and then achieving and maintaining systems transformation towards systems justice. And there's some key things to think about when we're looking at these different spheres of activity, is that all of this work, all like thinking across this framework, it needs to be grounded in equity and justice, and that essentially means and necessitates listening to and including the leadership of people with lived and living experience and expertise. The other piece is that this is not linear work. Working in these spheres of activity often intersects. There's often work happening in various spheres at the same time, and we need to be focusing in all spaces to really get to that transformation. As I said, and it's interrelated. Even the 6 conditions, it's sometimes hard, and we don't want to draw hard boundaries around these things, but it's a helpful way to start to think about where are the areas of work that we need to be focusing our energy on. And then the other piece is that no one size fits all, because it's iterative, because it's not interrelated, but it'll show up in different contexts in different communities. We need to be thinking about how to make sure our responses are not just trying to make a cookie cutter model of from point A to point B, but really thinking about what are the strengths that we're building on to different communities and their contexts. How do we make sure that communities see themselves in this transformation work and are able to define that vision for themselves and their communities? And so what we want to do with this framework is really use it to help us unpack the work that we need to do to get to where we want to go in those kind of key shifts that I talked about earlier. And that includes doing a lot of action-oriented dialogue. We hope to carry on more conversations with the community of practice and folks like yourselves that are tuning in today that are engaged in this kind of thinking and are curious to find out more, and do that in a systematic way to think about what are the tools and resources we can create to support communities in engaging with this framework and engaging with systems transformation. So we've got a ton of work on our plate, and so what we're basically doing today is kicking this work off with this national dialogue. And as I said, we want this to be the first of many. So I've talked probably enough. That's enough presenting. Lindsay, if you go to the next slide, what I'm going to do now is introduce our panelists so that we can get into our discussion for today. We are so pleased to be joined by 4 folks that are a part of our community of practice that have given feedback and input that has helped to shape the reports and have been great supporters of this work all the way along. And so today we have with us David Nesbitt from the who's a youth housing support worker from Oxford County Community Health Centre in Ontario. We have Doug Pawson, who's the Executive Director of End Homelessness St. John's, Shannon Murphy, who you met, who's the co-founder of Nishquay Consulting Group, and Susan McGee, who's the CEO of Homeward Trust Edmonton. So Lindsay, maybe we could stop sharing the screen now, and then I'll give folks a sense of how this conversation is going to be run, so we're all aware of what the rules of the conversation are today. We're right on time. We've got 40 minutes that we've dedicated to having this panel discussion. What we're going to do is I've got 4 questions, so that works out to about 10 minutes per question. And I'm going to invite one of our panelists to start us off, maybe give us a couple of minutes of some reflections on that question, and then opening it up to the broader panel so we can all have a bit more, everybody can weigh in. And then after that 40 minutes, once we've worked through those 4 questions, we'll open it up to the audience questions, and Mary Jane will pull some questions for us from the audience. So if that sounds good to everybody, we can get started. All right, cool. So to set us up for our first question, Doug, this one's going to go to you. So many communities may be in a position where they're having to reestablish or revisit their long-term planning and visioning work, which may have been sidelined by things like COVID-19. And while it may be frustrating to see that big picture thinking put on hold, it also could create an opportunity for reflection to better center equity in our efforts and do the difficult work of shifting from programmatic responses to thinking and systems thinking and approaches. So Doug, what advice do you have to give to support communities that are engaging in these hard conversations to fundamentally shift the ways they think and act on homelessness and create a common vision for systems transformation and justice?
Well, thanks for the invitation to join. And I guess before I get into that question, I'd like to begin by respectfully acknowledging the island of Newfoundland, where I'm located and presenting from today, as the ancestral and unceded homelands of the Mi'kmaq and Beothuk. And today, these lands are home to a diverse population of Indigenous and other people. And I'd also like to acknowledge with respect the diverse histories and cultures of the Mi'kmaq, Inuit, and Southern Inuit of this province. In terms of that question, which was a rather large question, and I hope that I can try and get to some of it, the pandemic for us as a community was really fascinating because it allowed us to, it kind of forced us into these conversations at the systems level that we weren't having, we were having, but in kind of an isolation. So it forced us, for example, as we had to set up a designated site for COVID, for anyone who was screening in for COVID testing, we had to really work closely with our health authority to develop some resources around harm reduction. And for a lot of communities, this is probably old practice now and old news, but for us in St. John's and across the province, we never had any harm reduction programming in place at the ground level provided by medical practitioners. So, after several calls and late nights with the directors of the health authority, they kind of saw like we can't isolate people if they have these more significant needs. It's not safe, and we need to work together. And so that really spawned for us an opportunity to work with our health authority in a more meaningful way. It allowed us to outline what a harm reduction program could look like for not just a COVID designated site, but what does a managed alcohol program at the community level mean, or a safe supply program mean at the community level, and to integrate those in with existing community-based resources. So today we have, a harm reduction team with nurses and nurse practitioner, and we're integrating additional supports and services into that, like occupational therapists and pharmacists, and in ways in which that they can outreach and liaise at the community level. So we took a part of our the COVID emergency funds and said, like, we need this obviously for our site, but our community has been lacking in these services to begin with. And so what would have been maybe 5 or 10 years down the line, we were told, we were able to get, expedited within 6 months. So that was a real win for us. And it wasn't an easy one. I mean, we celebrated today as if it was, it just made sense to do. But during the time that it was, we were trying to plan this out, it was very difficult. So I think for us, I think that was an easy one. We were able to use those investments, co-invest with our province and our health authority to make those available. We also worked with our provincial housing corporation to co-invest using those funds in a housing stability program. So we're now integrating health services and community services in a way that kind of very disjointed in the past, and there's so much more room to build from. So it's not to say we have the answer perfect, but it's just something that we are able to build from. And I mean, I have to acknowledge the work of our team, because we were kind of hobbling towards April 1st, 2020. We were just sort of leaving the city of St. John's. We were just on our way out, a team of 5, and, thrust into the pandemic like everybody else. And this team of 5 was able to set up, a designated site. We launched a housing program called Home Connect. Like we were able to just respond. And I think that was such a really important moment for our team. And as we've grown and built out our team, we've continued that mindset. Like, how do we respond? How do we pivot? How do we, integrate now our community plan to end homelessness with these responses that have now become sort of on the ground? So I think it's been really challenging and daunting, like a lot of folks. But I think for us, those were some really concrete ways we were able to more effectively work with our systems, integrate those services at the community level, and start focusing on more how do we plan for this in the long term, because these are the kinds of supports and services that will help provide better housing outcomes in the future.
Thanks, Doug. Cool to hear how systems integration has kind of been pushed forward and your response there in St. John's. Anybody else from our panel, any thoughts on this kind of way to sort of have a bit of a reframing and readjustment of how we're thinking about our long-term planning in communities?
I think what I would echo in terms of Doug's experience is just the pace, the pace of this work, and both the opportunity in it, the challenge in it, and to really be thoughtful about what that looks like going forward. It's going to be challenging to maintain. I'm sure there's lots of people that are participating in this webinar that are just kind of in that last mile that they think that they can do in a marathon, you know, but I think that it's going to continue to be an expectation that we, you know, as Doug's community has, you know, plan differently, plan fast, execute quickly, learn, and adjust. And that's now really compressed. And I think the expectations are going to remain.
I think what we saw too, especially in the pandemic, like there was a shift in identifying in our Indigenous communities as priority, and that was not always the case, especially like in things like SARS and vaccines. But I think there was a shift in seeing the urgency and the protection for our communities, that if COVID was to come into a remote community, it would go and it would be detrimental to the community and the loss of lives for elders and the children too. So I think being able to see vaccines go sooner, I mean, there was still learning all through this, but that protection to know that we needed to put safety measures in place, such as shutting down communities and access to on-reserve and rural areas. But I also think of doing that cross-sector of looking at like how were individuals going to receive medical. You know, being in Ontario, I think of like our folks in like the Kenora region that would be crossing into Manitoba, and that you know, we weren't allowed to cross provinces, but in order to receive medical care. So I think some communities really adopted really well to see, recognizing that this was a, you know, a huge barrier and how we were going to do that in that response. But I think that planning for the future of this is what will need to happen to ensure, and then also looking at, I think it brought a lot of light to those rural communities and the flyout communities, just how far and how limiting having access to things such as medical and housing. You know, these are plane rides, these are boat rides, ice roads that need to be taken to access. So I think in this time, bringing a lot of that light to the forefront to say, how is our response going to be to ensure the safety of our Indigenous communities? So.
I just want to echo, there's a few things. It was very interesting at the onset of the pandemic to sort of, you know, have the gaps exposed so raw. And Shannon, when you were talking about those literal, physical, geographical issues that, you know, the further north you go, you know, we kind of felt that momentarily, even in a place where services do exist. So I can't imagine how difficult it must have been. For me, any advice, you know, more as a point of thought too, is, you know, hold on to that moment that you felt at the beginning of the pandemic and sustain throughout. I come from a bit of a more of a frontline view than the other speakers, and one of the quite profound moments I had with the kids I was supporting at the beginning was just the anger they held within them. And you know, as I would talk with them and, you know, help them prepare, make sure they had food, you know, whatever it is that I wanted to make sure they had, that anger was an opportunity for them to express their experience against what the world was going through. So what that was you get to feel what I always feel right now. How is that for you? And this is what the kids were saying to me, and I thought, wow, yeah. So as we were all scrambling to figure out how life works when we lost everything momentarily, this is their experience every day. So hold on to that moment. I've actually reframed homelessness as like a COVID moment that I'll never forget. You know, keep that front and center as you continue with the work that you're doing. But that's what I hold on to. It's every day is that for them. It never stops until we help, you know, until we can create the conditions that make it stop.
Thanks, everybody. Yeah, and it's interesting to see how the things that folks are touching on that we want to pick up on and continue to think about as we move forward and thinking ahead towards systems transformation, what new things have come to light or maybe have had a bigger spotlight on them that we need to be mindful of, and as we're moving into thinking about creating new plans for what we think about for the long term. David, I'm going to pass the next question on to you, and to set this one up, I talked about how the shift to prevention is a big part of the conversation about what's going to come next for communities and their efforts to address homelessness. So really thinking about how to turn off the taps of people entering into homelessness in the first place, and ensuring that people who've experienced homelessness are sustainably housed and don't end up in a cycle of homelessness throughout their lives. However, preventing and ending homelessness is, as I said, not the sole responsibility of the homeless serving sector. We talk about how communities have gone to great lengths to coordinate their efforts and make sure that they are able to connect services to folks when they need them. But we know that there are still systemic barriers and failures, and that there are systems that need to take ownership for the role that they're playing in addressing homelessness, and in fact, in some cases, creating homelessness. For example, criminal justice systems, child welfare, the health systems, not always having plans in place for folks that are exiting with no fixed address. And so what do you, David, to put this one to you, what do you think systems accountability can look like in across systems with different mandates and responsibilities that may not see themselves kind of having responsibility for homelessness?
Yeah, so thank you for assigning this question to me. It's very relevant. It feels like something I have some tangible experience in lately. So again, context matters. I'm speaking to you as someone who serves 16 and 17-year-old youth in a rural community in southwestern Ontario. I'm a social worker, and I'm also someone with lived experience. So for me, when I hear that, when I think about shifting from eligibility and charity to rights-based approaches, from emergency and crisis to prevention and sustained exit, from focus on homelessness serving sector to cross-system solidarity, what does it mean and what can it look like on the front line? How does it impact youth day in and day out at the end of the day? One of the ways that we've approached it in Oxford and are having a lot of fun working this way is just to lean in cross-sectorally and just get through the grit of it. I have so I'm an access point for a team. I work at a health center. I'm community-based. I cross-share youth as a point of access with a community-based worker from CAS, a family and mental health resource support worker from our children's mental health, and a probation worker from youth justice. And, as I looked at, complexity in systems in a rural context and how much we have to lean in and rely on each other at the best of times, we had this unique opportunity when the pandemic hit, where we had to work even more clever and work together. So we had just finished our pilot year on the program and sort of agreed to continue, and then the pandemic hit, and then it was, okay, now what? What does accountability look like? For me, in my experience, it feels like intention, it feels like process, it feels like it feels like tension and creation and creativity. One of the things that values is an important piece that I forgot to mention in terms of advice that I would give. Homelessness is a political thing. It's something that we can solve, but it continues. How do we solve homelessness in a system where we essentially have to buy into it in order to live ourselves? There's a lot riding on housing, and nobody wants to be homeless, right? Intention, partnership, process, values, and politics are not off the table. How do we talk about that safely? How do we talk openly and honestly as partners about how we experience each other's systems and workers when we're working with youth? I think of things like, what services and supports exist in my area for this population? Who are they? What do they offer? What's their criteria? Where do their services end and begin? What are the relationships and dynamics within and between these services? Balancing my experiences against the issues highlighted in the literature, and are the challenges and opportunities in this community? How do they exist uniquely to our area? What are the conditions at all levels that create and perpetuate youth homelessness? What conditions do youth falling through the final gap between childhood and adulthood need, not to just dig out of a hole, but to thrive? it's relationships at the end of the day for me. It's relational through and through, from the bottom up. Now, I couldn't possibly talk about this in the time frame I have, but let's paint a picture. So I'm no longer in the world of sports, but I spent a significant amount of time of my formative years playing high-level competitive soccer. So I mean, I want you to think about, so if there's folks folks that are into sports in any way, I want you to think about your favorite team sport. I want you to think about a game where your favorite team just played as if they were unstoppable. And what did you see? What happened in that as you watched them play by play? Then I want you to think about the same team, but a time when they seemingly couldn't do anything right. Again, like, what was different? It's the same people, but they lost so bad. What happened? You sit there asking the questions. So I want you to think about that on your own time, but then I want you to flip it over to your work. Think about your vantage point in the system and the particular sector and the position you occupy. What does it feel like for you when it's working versus when it's not working? And what do you notice that's different? And again, ask your youth what it feels like. What are they going through? How are they experiencing it? Go to an appointment with them and then bring it back to your teams and talk about it, process, come up with solutions. Like, it's very gritty and tangible. I'd love to talk about this again with you guys. So I don't know if I ran out of time, but I'm going to stop myself there.
No, it's good. I like the visual of having a team working, whether they're working in solidarity or they can't get it together. That kind of, the latter seems to be what we're experiencing sometimes when we're doing this cross systems work. Anyone else want to jump in with a comment here?
I feel like, David, you're describing the regular season for the Toronto Maple Leafs and then the postseason. So it really resonated with me. But I mean, I think it's really important. You hit on a really important point that I know when I was going through the report it was important to make a cognizant note of it. And that is, like, systems change isn't just a transactional thing. It's a very much relational thing. And sometimes when we think about interacting with systems, it's in that sort of transactional nature. It's not about relationships, but so much of it is about relationships, whether it's bringing a young person to an appointment within a particular public system, or negotiating with a minister. Like, it drills down. The relationships have to form, and the intent of those relationships, like you mentioned, have to permeate from bottom up and top down. So I'm glad you raised that point. Thank you.
Susan or Shannon, any other comments you want to make on this question about systems accountability?
Like, so much. Sorry. I think there's so much to be said, and I think there's so many ways to look at it. Again, I'm speaking from my truth and my experience and the teachings that have been shared with me from my elders and knowledge keepers. So this is different, and I always will say, localize your knowledge so that you can understand the grounds that you are standing on and the people's histories that are there. But I think a lot of this, and as Doug was saying and David was saying, for Indigenous people, it is about that relationship. And we talk about it in a way of, like, we need to hold relationships and kinships so that we can understand one another, to see each other's and hear each other's perspectives, and to know what each other's roles and responsibilities are. So each of us plays that role. And if we look at it as a community and can look at justice and fully understand what are their roles and responsibilities, then we can let them do their roles and responsibilities and align it to ensure that there's not a gap in service, but that everybody is aware and taken care of, because it is a community and how we support one another. These are members of our community, so everyone deserves that balance, that care, and to have a place in community. But we need to also take a step back from that and look at the histories of our Indigenous people. And what I will say, just as a kind of blank statement, because it can go on forever, is Indigenous life needs to hold value to all, and it needs to hold the same value as any other nation. And until we can change the narrative and be seen as valued, and that we hold that, we can't do that change. So we need to unpack what that means and unpack those narratives that we have been taught and that we perpetuate in these systems. And I'll just leave there because we can go on and on.
Thanks, Shannon. Susan, any other comments you want to make?
I appreciate, and I'm really taking in more so in terms of just the learning, and I appreciate, David, the focus on the personal and the front line in this. And using a sports analogy really well, because I try to use them and I often fail and mix up my sports and what's an inning and what's a period and stuff. But I would also just acknowledge what I'm sitting with this is the fact that as we come out of, Alberta, where I am, just a really harsh third wave, how distanced I feel from that. I just really acknowledge that there's been times in the last 15 months that I feel like I'm playing a video game. I'm very, I'm distanced personally, and I'm very emotional in my work. So just how I sit with that as I go back to work, and how I think about the folks that have really sustained incredible effort in our community, and through different projects that we've opened, and some I've been more involved in than others. But I think that's something that I'm just taking away, and I appreciate regrounding in that.
So Susan, then this is working out well. We're landing on the person that's going next in our questions, which has been great. We'll see if we can keep that going. But yes, so Susan, this one's going to go to you. In the report, we talked a lot, and this was intentional. We were working with folks like Shannon, and we have a working group focused on Indigenous-led systems transformation. So we focused a fair amount in the report on the relationships between Indigenous and non-Indigenous communities and organizations and leaders. And we're starting to see that communities are having these conversations about what Indigenous sovereignty and self-government actually means in the context of addressing social issues, so including things like homelessness, while also recognizing that there's an unequitable distribution of resources to Indigenous organizations and leadership. So I wonder what your thoughts are on how colonial structures, systems, and practices can get out of the way, and how we, including in our positions of the folks in this panel and also the people that are joining our panel conversation today, could better support Indigenous-led systems transformation and responses to homelessness.
Wow, that's a big question. And I admit, and I think I would love to just sit down with Shannon and talk longer and more about this discussion, and many I'm sure that are on the webinar. But I think we do, as a sector, somehow manage to make the simple complex and the complex simple all the time, and I think in a couple of the responses to questions today, we acknowledge just the size of the system that is contributing to this crisis, and the generations that it has dysfunctionally, and the colonization and what that has been in terms of intention for a very long period of time, and the primacy of policy, and that we need to really always be working high and low, and like just kind of from that policy high level, really changing those systems, and also constantly learning on the ground in our work. And we will, I think it's a disservice to ourselves to try to simplify that, but also it's so important that we just first and foremost acknowledge that we and I'm in a course right now that has brought this really, in terms of language, to a very important place of just acknowledging that we are a country that is what racism is in Canada. Like, we deny so much in Canada and the way we think about Canada, and just to really acknowledge that. And we've seen so much denial of that, even in the face of the tragedies that have emerged just in recent weeks, but also just in years. And we just can't deny that. And when we acknowledge that, we can really, really then, I think, have those work together better. And there's so much good work that has happened, and there is work happening, and I don't want to, certainly not acknowledge that. And it's uncomfortable, because on one hand, people that are experiencing homelessness come into this often after so many other things have failed them. And if it isn't just the system within their lives, it's the generations and the trauma that their families and their nations have experienced. And so, recognizing that, and at the same time, sometimes feeling like the sector is responsible for so much, and all of these other systems need to change, and knowing how big that is, and at the same time, always every day trying to improve. And when we think about that from a experience of my work and Homeward Trust, anything that we've been doing, if we look back and we might think we were getting something right 10 years ago, we now know it wasn't it wasn't enough or we didn't. And I think that's an important learning, in that we have a long way to go, and we're going to continue to always feel and know that we need to be doing our best, and that it's not something like a goal. And I don't know how to word this properly, but feeling uncomfortable is something very important, in knowing that we just need to be relentless, but also if we think we have a goal in mind and that it's something that a box we can check and we can achieve it, then we're not understanding. I think we're trying to compartmentalize. We're trying to do what so often we do within colonial systems, is compartmentalize and try to, name a solution, when it's really transformational work for communities. And so being vulnerable, leaning in, accepting that is so really fundamental, I think, to being able to then impact in the model that the collective has put together around really acknowledging how big and messy that system work is. But it absolutely is so critical, because we will keep having this conversation if those systems and those policies don't change.
Thanks, Susan. Others with comments on this question?
I'll go first because I'm not going to get the question last. So, but Susan, you hit on like your points were just so important for the work that we do, because in our work we often talk about homelessness itself not being the problem. It's the result of intergenerational poverty, gender-based violence, trauma, colonialism. Like, it's the result of these multiple system failures. And so reframing it to be more on the systems itself, and how do we do that? It's incredibly uncomfortable, as Susan says. I know, like, just our organization went through a strategic planning process, and we had to say to our board, like, if you're going to be involved in this, it's not a simple thing. It's not easy. It's going to be hard, and we have to be comfortable with a lot of the discomfort that pushing these systems in order to resolve some of these problems will bring about with it. And none of it is easy. If it was, it would be done, right? So I think it's just that component of changing those systems is not something that happens overnight. It's not something that's easy. And where I like where the report and the community practice has helped me really understand the scope of this problem is that by applying an equity-based and a rights-based lens to it, it forces more accountability on the system, because we're framing the problem around the individuals. And I think there's a direct link between that we can now say, because of these things, this has happened, and we need to unwind and unpack and work together to find solutions. So that really resonated with me and gave me a language around the problem that I just didn't have before.
Coming from the world of social work, it's extremely important that I own my profession's history as I'm working with folks, and our history in working with Indigenous youth and like connections to residential schools in 60s Scoop and is undeniable. I mean, what does that mean for me, again, on the front line, or when I'm working with partners towards systems change? On the front line, it means protect those kids. It means surround them with community and the community that they see as community. It means going the extra mile no matter what. It means always leaving the door open to say whatever you want to explore as part of your future and your past. Like, I'm here to help you do that. I'm a liaison for that in whatever way possible. So I lay it out. This is what I can only move forward with you as I work with community to deal with past. In terms of a higher level, geographically, do you have good connections with Indigenous communities around yours? That's been historically a challenge for Oxford. We don't have one locally, although we sit very squarely on land that we do not belong on. We do have 3 reservations in London area, and we've got 6 nations in Brantford Way. So I mean, reaching out to those communities to ask for, how do I help this kid given what they're facing? It's like bridging that gap. But again, we don't have like a friendship center or anything. And one of the things I love about working with the folks that I'm working with in the way that we are is, as we come together as a larger group with our higher ups, you know, our last conversation was, we need a friendship center. How do we do this? And that becomes a goal. We need one. It's clearly missing for the kids that we're targeting, but our community in general. So, I mean, again, on the front lines, whatever it takes, and be there for that kid in whatever way possible, and protect them like they've never been protected before, right, by the system. Take that negativity and shield them from it. Hold it in your space instead of letting them have to hold on to it. They have to hold on to enough. And then what do you do with that with the folks around you, and how do you bring things that matter into your community with Indigenous-led folks that are leading from Indigenous community? I'll stop there.
Well, I just want to thank each of you here for coming, being present, and sharing and putting yourselves in those vulnerable spots and talking about it being uncomfortable. It's a very uncomfortable history. It's a very uncomfortable present day, what our clients, community members, and myself go through. So you couldn't be human without feeling uncomfortable hearing some of these truths. So so much of what you said, I'm just like, yay, because you talk about different things about, you know, Susan saying like just showing up and being there. And to me, what we're asking you to do is bring that spirit. It's bringing your whole self to these tables so that you can be present to hear, to connect, and build relationships. You can't build relationships if you're not fully present and showing up as your whole self. And a part of that is being authentic, is being okay with the uncomfortableness, but knowing that we're building relationships where we're going to take care of one another, that we can hear one another. And I think for me is a bit of that work of still unpacking those narratives and truths that we've been taught. It's going through to fully unpack what those truths have been told to us and those narratives, how they have caused impacts across the systems and how we provide service and care. And it shouldn't even be service, it should be how we provide care, how we provide connection, and how we care for one another. We need to unpack that, and doing that is by showing up and hearing what those truths are for your community. And I say for your community because we also have to be very mindful that we're not pan-indigenizing approaches. It is not a one-size-fits-all. Communities come with very different teachings, values, ethics, and practice. You know, we think about our Inuit and using the IQ principles. We could look to our Anishinaabe using the 7 grandfathers teachings. But it is knowing that you can come and build authentic relationships to begin to know how to move with each other. And I think David even just saying that, like, it's about moving with. And sometimes that may look like taking pauses so that we can really hear what is being shared, and sometimes not shared, but to be okay to kind of sit in that silence and take a pause, because trust needs to be reestablished, and this is going to take time. And you know, I think it was Susan, you started to kind of use the words like start and trying, like that we're doing this. And it reminds me for myself, some teachings that I've heard around like the turtle teaching and how we learn. And a part of that for ourselves is it's by watching, it's by seeing what's happening, to be fully present, to see where are the barriers or where are the issues that are happening or how are we moving. And then it is about trying and putting those things into practice and being inquisitive to say what's working, what's not. And everyone here has spoken about that. But it's only until we walk that part of the journey that we can actually start to pick up knowledge. But if we claim to have this knowledge and wisdom on how we're going to do it, we're setting ourselves up. So we need to take those step backs and do that work to see what are those gaps, how can we change that, trying it, being okay if it doesn't work or if it takes long, because it's through that we're actually going to gain that knowledge, and we're going to hear that from our communities. I always say ignorance is bliss, and I don't mean it in a negative way. I mean it for its definition, like an unknowing. But as we show up today and we share these things, we're in a place of knowing now. So how do we move through this? How will we move differently? Because we can't claim the unknowing part of it now. We're part of these dialogues. And, you know, I always say, and individuals that will sit with me, I will always bring up and continue to bring up, you know, the work of Jesse Thistle with the definition of Indigenous homelessness. We need to continue to breathe into that, and we need to continue to lean into it and apply it, because it's really truly in that work and that definition that starts to offer cross-sectoral like systems and doing this change, like that we're moving past the house and we're looking at all these other elements of the impacts of what's causing homelessness. So I use the analogy a lot of talking about our home fires and that promotion of we carry that identity and sense of self, but our communities carry fires as well. And fires and keeping fires are hard work. So we all have a role in that and how we can help, from chopping wood to fanning fires to standing there and watching. Because it takes a community, and there's interconnectedness always. We don't see systems broken down separate. We see the interconnectedness. So we see a lot of great work happening within our Indigenous communities because we carry those values of interconnectedness and knowing that we always have to look at the whole of the being and the impacts, and that expands to the extended family and to the community. So proud when we go into communities and hear these things and see the great things that are happening, because they're often underfunded and doing it with $0, but just with going through it with the passion and the care that they have. So yeah, and as David was saying about the building bridges, like that's what it is. Build bridges. We mutually can cross that bridge, but it's there for both of our benefits. It's not a single person's bridge with a toll on a single side. It is an open bridge that we can each take paths and take from it to do the care that we need for each other. So yeah.
Awesome, Jen. And you're already like setting us up for a good segue into our last question. Yeah, really speaking to those like relationships and connections, which other folks have also brought up in this discussion. That's at the heart of this systems transformation work, is relationships. And I think often gets kind of sidelined as like the soft skill that's needed in this like official planning work or whatever it is that we're doing. We kind of silo off relationship, or don't think of it as how integral it could be, because when we don't have that trust and respect and reciprocal relationships, we really can't expect our efforts to go as far or see the positive, sustained impact that we want to see. So I wonder if you have any further comments about what relationships that either you've built to better navigate the challenges of this cross-systems planning and leadership work, or what makes the relationships work, and how do you continue to nurture them over time to see that impact sustained?
Relationships, like I always say, it's the foundation to anything we do. We always start with kinship, and we always start with relationships. Traditionally in our community, we don't enter into like ceremony or into meetings without first building relationships and taking care of one another. You know, some practice like condolence ceremonies that, you know, it comes to before all else. Before we do anything, we need to take care of one another so that we can go in with a good mind and know that we're each taken care of, so that we can find common ground to then be able to discuss and the information or the meeting at hand. So it's foundational, because when you have relationship, you are making connection, and therefore you're invested. You know, a piece of you is now invested into that, and you have a different understanding to know one's passion or one's journey, and to support that. And I think, and for me, that part of my frontline work is going to come out, and you know, I hear David talk of it also a lot too, is it happens a lot of like off the clock or not getting paid for, but going in and making a relationship with a guard, with making a relationship with the child and family service workers, getting to know them aside from work, so that we can fully understand each other and know each other's roles and responsibilities. But then when we have a relationship, when we need to call out to someone because we have someone in need of assistance, or we just need a better understanding of why something was made or whatnot, it's through maintaining that relationship that it opens those doors. You know, and it's the same when we talk about individuals going into new agencies. It's so hard to ask someone to do that without there being a prior relationship. So even with that, knowing that you could walk in and say, we're going to be meeting with this health practitioner or this judge we know we're seeing today, but they understand, and taking that time to hopefully educate and learn more about, share more about what the barriers are in the community, and see how they can work with one another. But I think that comes also down to is understanding each other's roles and responsibilities, so that we can see how we can assist where there's overlap, to say, you know, I can support you in doing this if you can support me, or how we can make it better to help understand the individual. But I feel like we kind of talked about it, so I don't know how much more to add into that one.
Sure. That's great. Anybody else with any other comments on this role of relationships and connections in your communities and work?
I couldn't agree more. I wonder, and something that we can share as a sector, and some of the ongoing conversations that I think we need to consider is practices around reconciliation in those relationships in community. I mean, there's practices, there's folks I wonder what that space could be to really, really deeply learn and support what can be, you know, a process that's very deeply emotional about forgiveness of self, forgiveness of our own family's histories, and as David said, you know, going into the work and owning the history of social work in Canada and the 60s, like that deep work. I think sometimes I feel like we're kind of heady and cerebral in our discussion, and you know, just really understanding just how deep that work is. And I really appreciate the way you've framed it, Shannon. But I also think how can we support each other in that? It is very deeply personal work. And
yeah. And I think that's that trust and showing up for one another. You know, and being there. I think I will often say is, how much are we asking of and putting on another individual? Like, are we supporting in both ways, or are we just seeking to take information because we want that? Like right now, especially with everything that's happening, like with our elders, we didn't feel comfortable asking them to come and provide an opening right now. They're in a place of grieving. Some of them are survivors themselves. So it's an inappropriate time to ask more of them. It's time for us to step up and create space and hold space. And it's through those practices. But I think it's the showing up is how reconciliation is going to, I think, begin. But even before reconciliation, the truths need to be fully understood of what those truths are. Even when you look at the TRC, and we'll say it's truth and reconciliation, but you can't get to the reconciliation until we get to the truth. And I think for myself, and this is my practice, is I always tell individuals, I'm not asking other individuals to take on that burden of the color of being non-Indigenous or being a part of that, because we grew up in a society that didn't teach us that and taught us to see Indigenous people less than, or kept residential schools hidden. So you can't take on that burden of like you did something in that moment, but that's where I say like that ignorance. But now there's a knowing, so how do you move differently? And I think a part of that, and you're doing it by acknowledging and taking a course and asking questions, is constantly questioning, why does it have to be this way? Why is it that way? And not just accepting the answer, but then knowing the truths from an Indigenous voice, that it's their truths that we're hearing from. And I think we have put out, and by that I mean like our community members have gone through a lot to share their stories, so that that truth can be out there. And now is a time of how are we going to hear it, and accept it, that that is a truth of where we reside in Canada, and create a different space so that those biases are not continuing to be barriers for individuals that are accessing services in the health sector, in justice, and in the homelessness sector, that they're not faced with those biases to say, well, it's, you must be here because of ... But instead that we can know what that intergenerational trauma has impacted individuals, and that a lot of our people, and myself included, from being disconnected, are on a journey of picking those knowledges back up. So that's where I say to you, sometimes there's pauses, because we are still also picking up those and revitalizing the language, and becoming to a place that I can sit here today and be confident enough to say, I'm Shannon, I'm Haudenosaunee, and I can sit here and say that without going red or worried of what comes next. And I'm going to say that took me 20 years to get there. And I'm not 20, but that took 20 years of work in order to be able to sit here confidently. So each person has their individual truth and path that they're walking on, but I think it's having time to listen to who those voices in within your own community, and you know, being a person that got to come visit your program, Susan, and see the things that you were doing, and hear from the staff at running some different housing programs. It is what gave us passion, and knowing that those good things are happening to be grounded in traditional ways, and that those practices and values are being upheld for the youth and community members accessing services. So, or like, I applaud like your staff in that they do that and provide a safe space.
Thank you.
I'm mindful of the time, but I want to give space for Doug and David if you have any final comments before we shift to audience questions. We'll probably have enough time for a couple of questions for the audience, and Mary Jane's been watching the comments for those. Doug and David, any other thoughts you want to give on this conversation about relationships and connection?
I would, what to say? I mean, that was awesome. You can't hold, you can, it's hard to hold people accountable if there isn't space there to do so. Make space to talk about issues like race, class, mental health. What is, like, not losing sight of that experience? How are we impacted by it from our particular vantage point? How, as Shannon said, do I give you a leg up so that you can give me a leg up later? Yeah, I mean, it's sort of unignorable, and I just think it's important to make space for those conversations to happen, particularly with folks who live that every day. So when a youth, a person wants to talk about colonial history, I make time for that. Sometimes it takes an hour, and that's okay. Sometimes it takes 5 minutes, and that's all they needed. It has to be okay for them to talk about it, and the only way to be okay is to make space for it and let it happen. Nothing is going to happen from opening that space other than understanding and getting closer and more comfortable with the idea of that, you know, I don't know how else I would say that, but just make the space for it and have those conversations at every level, but particularly with kids. They need to know it's okay to talk about it, no matter what their vantage point is or their intersectional identity. Sorry, go ahead, Doug, if you have.
No, I mean, I'll just pivot a bit because I really appreciate what Shannon was saying there. I think when it comes to working with systems, you know, the old adage of let's get creative or bend rules we don't want to bend rules or be creative. We want to fix the inequities in the system so that we don't have to be creative and we can be responsive in a more helpful way. So that's something that I think is really important for us, and that's where a lot of uncomfortable conversations have started, but productive conversations have emerged. So I'll leave it there just in the interest of time.
Well, thanks so much to our panelists for answering our questions or starting to unpack these. I know they were big ones, and it was a tall task to cover them all in the time we had. So now, Mary Jane, I know you're maybe not going to come on video. You can come on video if you'd like, or you can be our omnipotent voice of questions from the voice.
Sure, we got lots here. I don't know how many we'll get through, but the first one's really interesting. Claire Strawn asked us, how does your COP, and I would, say our whole systems planning collective, including the COP, address the underlying economics of homelessness? And she's referring here to market failure, speculation, public investment versus socially supported housing investment. So that's an interesting pivot on our conversation, but I'm also just going to lead a little bit with I think it really lends well to our conversation around what rights-based is and how we can realize progressive realization of a right to housing, possibly other human rights. So that would be my sort of lead, but is there any of you who would like to take that on? And if you want to take it away from the rights-based piece as well, that's fine. I don't know who to pick. I'm kind of looking at Susan, but Doug.
Well, I can make a comment quickly, and I think then other people will jump in. A comment and a caution, because actually I think it's an interesting question, and inherent in it is one of my biggest concerns, is that the sector, in our diligence and our effort to be, really solving the bigger problem in this work of this system planning work, community practice, is that we have some risk of taking it all on, and when we see the outcomes, and honestly, I think they'll be significant and compounding in the upcoming years around the economic disruption of the pandemic. And I can just speak from my little community of having homelessness increase for the first time in 13 years because the Housing First program has worked, our programs have worked, but we've seen it rise significantly. That's at my feet, and I feel like this is a pandemic. This is a global crisis, and as a sector, we end up owning it all, and I worry about that. I worry about how awesome this report is, how much it speaks to the complexity, how the elevation of the work in community, and that we are now toe to toe with these billion-dollar systems like health and justice to try to solve this. Is that we are kind of implicit in having to have all the answers. And I'm concerned about that. So I'm not answering the question, and I don't mean to answer a question with a question, but one of the things that I'm really concerned about is that we can spend, all of our time in that space and stop housing people as real, because we're still, the scarcity of the sector is still what we are all struggling with. There just isn't enough resources to do the work to scale sustainably. Housing First was never intended to be a forever. It is to get, individuals from crisis, be the analogy of, drowning to the beach, but those systems need to help. But I really do worry that we're going into a number of years here where more and more those massive macro level economic and other compounding issues are going to be at our feet, and we just can't do it all.
It's a big question. That's a question thinking about where is that other outer layer to even our public systems that we're trying to transform, which is this global financial situation. So this is a huge question. So, but if anyone else would like to, sorry?
I think Doug might have some comments on that one.
I mean, in a previous world, I studied financialization, and the financialization of the housing market is something that Leilani Farr has covered impeccably. We would echo Susan's comments. Like, this is something that when we kind of are at the center of these COPs and plans, we kind of bear the brunt of everything that might go wrong. And so I think we have to be cautious of that, and we have to be able to stipulate what's in our control, what's not. But I mean, when we think about the market failure in housing markets, right? For example, like when we see these rent evictions happening and we see these mass evictions happening around the country in order to build new and more expensive condos and all these things that are forcing low-income individuals into that place of experiencing homelessness or at imminent risk of that. I mean, when we look at some of the responses that the federal government has that's provided, like the Canada Housing Benefit, I wonder, would we need, if we had regulation around the housing market for, if we could limit the impact that these REITs and large corporations have, would we need to invest in CHBs and rent supplements and that sort of thing? If our federal government and pension plan, like the CPP Investment Board, were not massive investors in these large corporations, would we not be in this vortex that we're in where you just can't get out of it? And I think, when the government comes out with the concepts around social finance strategy and investments into housing and social housing, we need to say, that's great, but if you actually disinvested into these big and regulated these big corporations and protected the housing market writ large, we wouldn't probably need all of these investments. You probably wouldn't be forcing to be so susceptible to the stresses that homelessness is causing. So there's a lot of big macro indicators that impact the housing market, and I think there's space for advocacy there, but I don't think as a sector we've kind of targeted that space yet, but it has to come. It has to come because there's just such a shortage everywhere. So that's my 2 cents.
David?
I was just gonna say, when you think, I don't mean to come across as like I'm diluting it and simplifying it too much, but sometimes we look at complexity and we think, oh gosh, and I'm like, is it, wouldn't it be cool to figure it out? I mean, the pandemic is like a once in 100-year opportunity. I mean, the last time this happened was, it's that the Great Depression, when people became acutely aware that you could be poor through no fault of your own, that you could work 3 jobs and still not put food on the table for your family. I mean, there's definitely a lot of issues that contribute to it, from a living wage. Like, I'm a huge proponent of basic income and what it means for vulnerable communities, but everyone at large. But I mean, I'd rather sit with that place of, wouldn't it be cool to figure it out as a group? And that's what I see in this community of practices. We have to push back on the idea that it is just our problem as a sector. We know that's not true. Like, I don't have the macroeconomic speak to sort of get into the weeds with it, but so I get the privilege of like living in this space where I can be like, yeah, we can do this. But I mean, the pandemic stripped everything to its roots, to its bare bones, and we got to see it like super clear. And we've got a window and a little bit after the pandemic to make some very big gains as a sector and as communities to eliminate homelessness. I'll leave it right there.
Great.
Yeah, I think I agree with everyone. Like, I agree with Susan, like, to be like, I couldn't even begin to where to answer that. But I also think hearing Doug and what you're offering, it makes me think of, are we so immersed in it that this is such our way of life that we can't really see all those other things? And what does it look like for us to sit on the outside and kind of see all those things in play? And even having someone like that's not in housing kind of come into it. And I think that's what's interesting, what you're offering, Doug, is like this whole other element of how it's funded into, and it's I think I'd be really interested sitting on the outside and kind of looking and being like, what is all happening? But at the same time, I'm like, how do you answer that? And I think we're expected to have those answers, and it's like, no, we're like, just trying to ensure that we're following like that rights-based and doing all of this, that you're asking us to also step outside to see what is the root and come up with like that solution. And I think that's much bigger conversations.
Big task.
And that kind of flows into a little bit into another question. Keith Anderson is asking us, There's been a renewed emphasis on cross-sector and non-traditional service connections, but I wonder if we're missing the boat. I don't hear a lot of focus on engaging the community at large, general citizens and neighbors not being engaged in homelessness. Identifying people as needing to engage in services seems to perpetuate the notion of exclusion from the community. Thanks for your thoughts. Is there anyone who wants to take that outside of our sectors and systems and into the broader community?
I think if you involve community, you're involving investment. I've seen this in the earlier sector when establishing family centers and childcare centers that they created community tables where it was made up of neighbors and local businesses so that they could all learn about what that looked like for their community. But again, what was everybody's roles and responsibilities to ensuring that safety of the community and that people had a sense of belonging and that there was engagement. So it created, again, relationships and investment into that and a sense of connection. But that is coming from a lens from when I did some work with earlier sector. But I don't see why we wouldn't want to also engage in that too as a housing sector and community. So because we see it, people know who the individuals are that are walking through their communities. They know who those youth are, and sometimes they don't know how to approach topics or offer help. Coming from a transitional house and a wonderful neighborhood, we had housing owners that would come and say, you know what, we have a pool, we would love to open it up so that the children can have a space to go swimming, or just bring welcome baskets if they knew there was a new woman and family coming that included toys and just welcome to say, welcome to our neighborhood. So I think it'd be interesting to see what that looks like.
Yeah, I totally agree. And I think I would absolutely say community's critical. Community's critical to somebody's path, be it on recovery or just, connection to the neighborhood that they live in. I mean, that's where we're trying to get folks into a place where they can really be in community, and communities that they also have experiences very hostile to them. So a community's that's extremely important. I want to acknowledge the tension a little bit in the work, in that everybody's interest to be at a table doesn't convert into us having more and more tables. And sometimes, engagement spaces get so big, and I joke that sometimes I feel like, spending more time doing the work than the job, because I just like, you could just be engaging all the time. And I think that there's also, another, sorry, I'm terrible with using too many analogies, but you can have like 6 people trying to fry an egg in this sector, and it's sometimes the work just needs to get done. So that tension is what communities have when they have to be like really community validated. It's our permission to play. We have to have community engagement, and that broader, like those neighborhood roles. In Edmonton, we have community leagues. They have a long history of kind of really shaping and leading in communities. Having all those relationships is so critical. And the tension there is that, I guess, a little bit thematically to some other things that have come up is in the same way, it becomes the burden of the sector to make all of that happen and support it all.
Yeah.
Right. So, we're like, it's like, just, it is a responsibility then, like communicating accurately and authentically, being called out on data if, 2 different numbers with 2 different timeframes don't add up. Like all of our community communication and tables have to be supported well in order to not create an kind of that unintended consequence of actually really pulling us down from the work and doing well. So I just acknowledge that it's so critical, but there is tension there for sure.
Any thoughts on that, David or Doug?
I was just going to say that tension, of course, and the risk of like engaging with NIMBYism and not those people in my, in my area. And I think you have to have good relationships at a service level to engage with that in a meaningful way. In saying that, there are groups in our communities that we have to find and enable that are doing the work out of the goodness of their hearts. And like I think about, there's a community free table in Woodstock in my area where they literally have been setting up every noon hour right through the pandemic, just taking donations and giving it right out. I mean, that's important and that matters. There's a group in St. Thomas that they're lived experience folks who hit the ground every night and they do outreach with folks, with homeless folks in St. Thomas and Elgin. And those groups, like, how do we work with them more effectively, and what, you know, I think it's a balancing act, but the quality, our interactions, the way we build up understanding and connection is based on, you know, the quality of interactions, not necessarily the quantity, right? So I think it's a balancing act that is intentional, and you really just gotta do that right. There's a right way when it to engage with community, I think. But I'm by no means an expert on that area, right? So I'm going to toss that over to someone else if.
And I, not to rehash any of the points, because I think Susan said it really well, as you know, from my perspective and how I've seen it play out here in St. John's and as well when I was in Ottawa. But I mean, one of the things that I really like about the approach here is that it's rights-based, right? So it's not a charitable thing that people should live in a neighborhood. It's their right to live in a neighborhood. So reframing that from it's the right thing to do to like it's their right is going to go a long way, you know, over time. And I don't know how we'll get there, but I think that is really important.
Yes, and from the, you know, from the family and natural supports work that we're doing with young people and these homelessness, the community and those neighbors and cousins and the local folks are really, really important to helping connect those young people to their community so they can stay in place too. So, and that fits beautifully in with the rights-based as well. So, so here's another question from Irene, and it's a little bit focused on Indigenous people experiencing homelessness with prioritization. So if this is a hard question, please feel free to but it could open up some really interesting conversations about prioritization. It is a bit pointed. Thank you, Irene. Indigenous people experiencing homelessness and who are going through the process with a worker to access help, example, limited community resources, are prioritized by assessment in order to be prioritized to access limited resources. This concept of assessments for prioritization is a mainstream method and concept. For the Indigenous panelist, or for Shannon, sorry, if you were to design a new tool that is grown from an indigenous way of being, what elements do you see as important?
Wow.
We could maybe respond to later too, but let you.
Well, I definitely think how I will talk about that is that we do identify that as a need, that we don't prioritize in that way. It does not work for our community. It also has so many barriers to it, and how we work with our own people. And so we have identified this as a part and through this work. And so this actually has come up to say we need to continue. And what I will offer to that is a part of continuing is hearing what is working from our communities. How are our communities working with our own people? What are those promising practices that we can amplify that great work and say, and present it to say, okay, we can't be doing this. We know this works. And a part of that is that self-determination and self-governance of our communities. But I think it is what we are working towards. And I would feel that coming from and working frontline and having to prioritize, I just didn't. I'm going to completely honor that. I'm no longer working for any agency. I didn't prioritize. If you came through the door and you needed housing, we worked with you to do housing. We just were like, no. And I think a lot of agencies have done that and taken that approach of just saying, no, we will not We will not score, we will not prioritize, we will just service, and we will wrap around this individual to ensure their needs are met. And we will do that maintaining their dignity and their autonomy. But we do need to kind of put that and formalize it in a way that it could be recognized instead of us just being kind of like, yeah, no, we're not doing it. But not everyone can say that. But I think we really are working towards that and collecting that collective voice to really say, like, this is not working for us. And we need to move to a place that looks at the roles, responsibilities, the values, the principles, and not as a tool or a screening, but just seeing the individual and giving them what they need. And that's the part of that right space of just, you know what, this is what you have identified that you need, and we're going to work to do that. We're not going to ask you to prove that or have to have you meet a certain standard in order to receive, but it takes a community. And it takes system transformation in order to do that, because that's where we all need to take responsibility in our roles.
So,
but if someone else has a wonderful idea of a new tool or
no, I think that,
oh,
go
sorry,
ahead, go ahead, Amanda.
We're at 2:30, so if we can stay on to finish up this question, that's great. I'm just mindful of the time, so people are this
right.
Any other
And I will be really, really short. I mean, I just, so to understand the question in terms of a tool, there's no magic tool. I mean, these are all just things that help communities solve their problem of having too much need and not enough resources. And I think the thing about this, the report and acknowledging that systems work, that because I think prioritization has to move past this barrier to access. Like, it's not to say you get housing and you don't. It's about connecting people to the right level of support that is going to help them fastest. So maybe there's a language thing we need to evolve. And that's where I think this evolution around the language of system planning and that reliance on those other systems, because you just can't do this work with a program. So if we're talking about prioritizing in terms of one program, yes or no, then absolutely, that's you know, that's never going to make the difference that we need to make. And so that's, I just, you know, maybe some language needs to be developed and nurtured here from where we were. And that's okay, because that's what this is about.
Fantastic.
Are you
Okay,
gonna?
yeah, I think I'm gonna wrap this up so we can I see people are starting to wrap up. So what I just want to say is, again, a huge thank you to our panelists for jumping in here and answering some tough questions. And this is, again, going to be the first of many conversations moving forward. In terms of actions you can take as audience members and attendees, we'd love, hopefully you've been inspired to read this report. If you haven't already and you're wondering, like, oh, what's in there, you should get onto that and share it widely. And if you're resonating with any of the content we've talked about today, or as you're reading the report, we'd love to hear from you. Erica's just dropped a link in the chat to a survey where we're just like want to find out what points kind of connect with you, and maybe if you're interested in this community of practice and want to have a conversation about it, we'd love to hear from you on that. And also just like think about it in terms of your advocacy with governments and other community folks in your community. We're going to continue to develop tools and resources out of this report within the community practice that can help with that. But we really just want to all show up and show solidarity with one another, that we're all doing this very challenging work, but it's good work to be focusing on the systems transformation for equity and justice in our communities. And we want to support you as the Systems Planning Collective in whatever way you need to do that. So with that, I'm going to thank everybody. We go to the last slide. You can see this is what the report looks like, and I'll let you all go for the day. And thank you again for joining us on this conversation. Take care, everyone.
Thank you. Bye-bye.
Thanks.